All right, we're up to almost 75 attendees, so I think we're hitting a quorum. So we'll get started. This is Mike Fishman again, MEF Associates. I'm going to start our afternoon off by introducing Kinsey Dinan, who is the president of NAWRS. Kinsey.
Hi, thank you, Mike. I'm Kinsey with the New York City Department of Social Services and the president of NAWRS, and I'm very excited to have the opportunity to introduce this event. For those of you who aren't familiar with NAWRS, the National Association for Welfare Research and Statistics brings together researchers and analysts from local, state, and federal government, from universities, and from a wide range of research organizations, including the hosts of today's webinar, APT Associates, who share the common goal of promoting better human services policies and programming through research and analysis. And it's very exciting to see all of these different groups represented in the webinar as participants today. The NAWRS workshop has been our organization's primary forum for exchanging ideas since the first workshop was held 60 years ago in 1956. Our next workshop will be in summer 2017. We've moved to a biannual schedule with our workshops on alternating years with OPRE's REX conference. And we'll be sending details on the location and theme of that event soon. So if you're not already on our list, our email list, please go to the NAWRS website and click on Getting Involved. But this year, in lieu of a workshop, we've planned an exciting three-part virtual panel series. And this, of course, is the first of those three events. So I want to thank all of those who organized this event and who are speaking today. I also just, because he's, I know, on all of our minds, I wanted to thank Michael Bono, an incredible NAWRS leader, former NAWRS president, to thank him for his enormous contributions to the vitality and sustainability of this organization. As many of you know, he was recently diagnosed with a brain tumor and is undergoing difficult treatment at UCLA. And Michael, if you've joined this event today, just know that we're all thinking of you. Today, we are going to be hearing from leaders in the effort to promote rigorous evaluation at the state and local government social service level, bringing us insights from their experiences implementing randomized control trials to really learn what works. And so without further delay, I want to hand this over to Mike Fishman of MEF Associates, who has happily going to be moderating this session for us. Thanks.
Thank you, Kinsey. I'm very, very excited about this panel today. For those of you who aren't familiar with the NAWRS Research Academy, we held the first NAWRS Research Academy in Baltimore in summer of 2012 as an effort to start to use NAWRS not just as a forum for sharing research results, but also as a forum for building capacity among everyone who's involved in state and local research and evaluation in the human services field. And it's interesting that our very first Research Academy focused specifically on building capacity of state and local governments to do randomized control trials to improve the effectiveness of their programs. And that's been a passion of mine and of many, I'm sure, who are on the phone today. We've all made considerable progress over the past 4 years. There's much more activity now than there was 4 years ago, but there's a lot left to be done to build the skills of all involved, to identify opportunities, to embed the use of randomized control trials into state and local research, as well as performance management activities, and to really hone in on the types of questions that might be best addressed by the use of randomized control trials. A lot of work in this area has been sponsored by the Administration for Children and Families, and I think many of us are familiar with the work that they've been sponsoring. But we really wanted to use the Research Academy today and this webinar to shift our focus away from some of the work that's been sponsored federally to some of the exciting work that's been sponsored by foundations and others around the country. And so in that regard, we've got a very exciting panel today. If I can get this to work. Why isn't my screen moving?
Hey, Mike, this is Wayne. If you click on your presentation.
I got it.
Okay.
I got it. Thank you. I am technologically challenged at best. So so we have four panelists that are joining us today. I'm going to introduce the panelists. They're going to go through their presentations, and then there is a box you should have in your control in your panel that you're all viewing that has a place for you to ask questions. And so as questions arise for you during the course of the presentation, please type them in. We will keep track of them over the course of the presentations, and then when we're done with all the presentations, we'll answer as many questions as we can for those who are listening, and I'll direct the questions to the appropriate panelists. We are recording this session, so those of you who want to look back on it or suggest that others view it, there'll be an opportunity to do that, and I'm sure we'll get out a link to enable that. Our first presenter is Angela Hawken. She's a professor at Pepperdine University, recently moved to NYU, where she's leading a new center called Litmus, which focuses on innovation and experimentation in the public sector. Angela is the founder and director of BetaGov, which is an organization that assists agencies and other organizations and practitioners to develop and conduct research that tests promising ideas for improving policies and practices. Thanks to the support of philanthropies like the Laura and Jon Arnold Foundation, all of the assistance is provided to states at no cost. The goal of BetaGov is to dramatically increase the pace of practitioner-led trials and learning about which innovations are promising and which are not. Then we will, and along with Angela, Steve Corsi, who is the State Human Services Director in the state of Wyoming, will speak to the experiences that he has had in Wyoming working with Angela's organization. So you'll get a kind of a state perspective. Next, we'll hear from Elizabeth Linos. She's the Vice President and Head of Research and Evaluation for the Behavioral Insights Team, North America. Her research centers on how to improve government performance with a specific focus on recruiting, retaining, and motivating public servants. She has led a series of projects on city-level innovation as part of the What Works Cities initiative, as well as organizational behavior projects with police, teachers, social workers, and civil servants. Elizabeth holds a PhD in public policy from Harvard, and she has also, in addition to her work with Behavioral Insights Team, has some work experience in the public sector, in government, as a policy advisor in several different venues. And then finally, last but definitely not least, we have Jon Baron, who is the Vice President of Evidence-Based Policy at the Laura and Jon Arnold Foundation, a nonprofit philanthropic foundation. He leads the foundation's strategic investments in rigorous research aimed at growing the body of evidence-based social programs and scaling those shown to produce meaningful improvements in people's lives. Prior to joining the Arnold Foundation, Mr. Baron was the founder and the former president of the Coalition for Evidence-Based Policy, a nonprofit, nonpartisan organization that worked with federal policy officials from 2001 to 2015 to advance important evidence-based reforms, many of which have been enacted into law and policy. So we've got an incredibly distinguished panel today. I'm very excited to have them all share with us. So Angela, I'm going to turn the panel and the screen over to you.
Thank you. And good morning or good afternoon, depending on your location. I think my screen's going to take a few seconds to pop up. While it does that, I'll give you a little bit of background. We created BetaGov essentially from just the frustrations we were experiencing in the field, and noticing how slow research was, and how difficult it was for folks on the front lines to be able to raise their hand and test whether something they thought was innovative was working or not. The research was either too expensive to do, or it took too long to do, and there was just a disconnect between what we saw was a real interest for experimentation on the front lines and where the traditional research approach was. Now, for those of you who are on this webinar and have either a background in research or in practice, all of this terminology that I'm throwing onto the screen right now is something that you've all kind of been very familiar. You may have said yourself, or you've certainly heard out there in the field. The idea of adoption, of just adopting a new practice, or just getting folks to buy in, that the issue is research to practice, or really what we just have to focus on is dissemination. And if there's resistance, let's just overcome that resistance. And we've all heard the language of bridging the gap. But if you listen really closely to the language of bridging the gap, what it tends to mean is let's find ways to bring people over to our side of that gap. It's very rare that there's a heartfelt effort to actually do much bridging rather than, I guess, nudging in our own own direction. There's also a lot of language about organizational readiness to change, that somehow if the practitioners in the field aren't wanting to do what we want to do to them, that the issue again lies with them rather than with the innovations we're bringing to them, or the fact that we might have entirely left them out of the process of innovation. So actually, as our team, we prohibit all of the terminology on the screen. We don't do any of this. What we try to do instead is really engage the front lines and make research organic to the organization that we're working with, rather than something that is done to them. I think we have, I hope you don't all see pop-ups on my screen. In terms of the state of evidence-based practice, I think many of us on this call share a common passion for helping the public sector figure out what programs or practices are showing promise and those which aren't. And even if we look at programs that have the label of evidence-based practices or evidence-based programs, some of them are really good, but we all know that many of the programs listed on those lists, some of them are much less good. And it's hard for practitioners to know which is really an EBP that justifies the E in the EBP and which should really be set aside. There's also a challenge of transferability. I've worked on several projects that looked very promising in one jurisdiction, but when transferred to a different set of local circumstances was really quite different. In some cases did harm. Not just no different, but actually could do harm, because the local specifics were just different enough to make that implementation be something completely different when implemented in that local jurisdiction. So as a team, we really started to think about what we need is just a different approach, a different model for generating knowledge. And we like the idea of a homegrown evidence base, making sure that folks in the front lines or people who are running agencies recognize that the onus was on them to test whether the projects and the practices that they were implementing in their agencies worked with their staff on their caseloads in their own backyards. And we wanted to do was design an approach to really facilitate this model of homegrown evidence-based practices. At the same time, what we noticed as we started working across the country was the frustration with really a frustration with research because of the timelines involved, the tortoise trail, which is fine for certain really Cadillac sorts of studies, but for many of the quick studies, these pilot initiatives that states and counties want us to innovate with, it was just not appropriate for their timelines. And I'll give you some examples. You're all very familiar with this. From the birth of an idea through the funding cycle to publication in many areas of social service agencies can take 5 years or even longer. But in the meantime, the average term of a Secretary of Corrections, for example, is only 2 years. We've actually had a spate of turnover now, so it's probably much shorter than that. For human services, it's only 18 months. So when the research timelines are 3, 5, 7 years, but the turnover in leadership is 18 months, there's a disconnect between the people who have to make decisions and the people who are producing the knowledge. What we've also done is managed to make research extremely expensive to do typically. Most research is just prohibitively expensive for agencies, so that very few ideas are able to be tested. And the result is that most programs we see in practice are either an accident of history or they're just based on feels good or feels nice. This is my gut feel of what I'm going to do, because we've made it so hard, so expensive, and so long to do that testing. So BetaGov is really born from that frustration, what we were hearing from the field about there was just this gap in what needed to be put, what help they really needed to get those ideas tested in a way that was rigorous. So BetaGov, it's a non-profit, it's funded entirely by philanthropies, and what we do is provide support at no cost to any government agency that wants to conduct a randomized control trial. And we really try to encourage them to look at low-hanging fruit, things that are very easy for them to implement. What we like about that is it starts to generate this philosophy on the front lines that research is no big deal. We can do it. We can all do it if we just work together. So we've removed the barriers to conducting those evaluations by speeding up the timeline, and the goal is to make research the norm rather than the exception with this homegrown practitioner-led trial approach. What we really like to do is what we call staff initiatives. We spend a lot of time on the front lines soliciting good ideas from staff and then working with them. We call them the pracademics. They are trained by our staff at no cost to them on how to oversee the trials that we work with them on, and we listen to them very, very closely. And if things work well, we do it again. If things don't look like it's going so well, we scale back before any egos are invested in the endeavor. We also really like client-led innovation. We think the folks who know the most about the issues we're trying to solve for them are the folks who actually wear the pants and walk in those shoes. So we do a lot of client-led innovation, listening to the folks who are being served by government agencies and trying to develop initiatives with them that can then be put to test. Actually, some of our best trials so far were client-led innovations when they raised their hands and came up with a good idea. Here's a few examples of what we're working on. I'm going to start with a few from criminal justice and then move into our health and human services portfolio. All of our work in our criminal justice line is funded by the Laura and John Arnold Foundation. What we're doing, and why I'm talking a little bit about the criminal justice trials, is it spills over, these ideas spill over very seamlessly into human services and social services. So this first trial I'm going to talk about is part of our Changing Spaces portfolio. We have a full portfolio dedicated just to changing the environment in which social services are delivered. So, and this is a trial in segregation, so inmates who are held in isolation. And the idea was to try to provide more opportunities for programming, but in congregate sessions, so allowing them to have more socialization. Typically, these interventions were done cell-side. All we saw until very recently, what you see on the screen now, was the cutting edge of congregate programming, putting people into these sorts of cages. Very little good happened in that sort of environment. It was a very negative space, and the interactions were very negative. Well, I'm going to scroll forward just 4 weeks later. This is the same room. These are chairs that were designed by listening to inmates. They are fully restrained in these chairs, but the atmosphere is completely changed. It looks much, I'm a college professor, it looks much like a college classroom. And inmates' behavior changes just as a result of changing the environment that they're put into. We spend a lot of time working on technology now, listening to the field and how they might engage their clients better, both on criminal justice and in health and human services. Text message reminders for appointments. This is an extremely inexpensive intervention that's showing very good results in the sites that we're working with. We're looking at text message reminders for medication adherence, especially for people with severe mental illness, and many, many others. Hello, gummy bears. Many of the individuals served by caseloads with its criminal justice or health and human services often suffer from certain deficiencies, especially nutritional deficiencies are very common. So we're looking at interventions now based on the work out of University of Pennsylvania, Adrian Rain's work on, for example, omega-3s. We're also for mental health caseloads looking at vitamin D deficiency. Very inexpensive mechanisms for helping folks try to bridge those deficiencies that they come to us with. A lot of work on incentive-focused pilots. So, for example, we're testing incentives for behavior management. We're testing different approaches to improve medication adherence for the severely mentally ill. For example, we have a trial in Pennsylvania where individuals with severe mental illness are paid 10 cents a dose to adhere with their medication. Medication is much higher as a result. And looking at all sorts of strategies to try to motivate compliance with whatever is needed to help that individual succeed. We're doing a lot of intervention now focused on staff reform, staff job satisfaction, and changing spaces. For satisfaction, we're testing different ways of rewarding staff just in terms of kudos, well done. How do we express recognition in ways that resonates with staff? Our Kudos Corner started in Washington State and is spreading across the country now. Different ways of allowing the caseload to express appreciation back to their caseworker. That's closing that cycle, getting that feedback in is really important. On changing spaces, we're changing colors, we're changing smells, and we're changing sounds. What's playing in the lobby when you come in? What does that lobby look like? Can completely change the nature of the first engagement. On changing atmosphere, we're looking at different uniforms. What do folks wear when people come to our offices? We're looking at differences in context scripts. So what is the first words that are said when a telephone is picked up for a child service call? We're looking at changing titles. How people describe themselves changes how people feel about them. More specifically in human services, and many of the criminal justice trials spill over into human services, the changing spaces, the changing titles. On human services, we started in Wyoming, and I'm so delighted that Steve Corsi is on this call with us today, who's the Director of Family Services in Wyoming, and he really took the leap of faith as the first agency to play with us in this space. And we now have Kansas on board in Florida, and about half dozen other states are coming on board now. And we're now looking to launch our first multi-agency trials, which we think is really important because many complex social problems require multiple agencies to be at the table simultaneously when we're thinking about more complex interventions. On human services, for example, we finished a trial in Kansas looking at energy assistance, just mitigating the paperwork. I think many government agencies have paperwork that's more complicated than it needs to be, and we end up turning people away just because they're overwhelmed. And we also add all sorts of complexity and drain staff time when unnecessary paperwork is being processed. We did paperwork trials for energy assistance and unemployment insurance verification. We're doing a lot of trials right now in terms of notification. How do you communicate with people? Should it be a letter? Should it be an email? Should it be a phone call? If it's a letter, should it sound very friendly, or should it sound more legalese? When you're doing trials with thousands of cases, you can very easily start to modify the nature of that engagement and see which strategies tend to work best and for which sorts of clients. We're looking we're very interested in engagement with caseloads. We're looking at alternative scripts at call-in centers. If someone's calling in for child services, what should the first words be spoken? What words should be spoken? And does a different friendly opening statement result to a higher probability that that call will be maintained, so they have a lower loss rate in those service calls? Lots of trials around text messaging in human services for court appointment reminders. We're seeing nice differences in outcomes here. For SNAP, looking at for those people who are eligible for expedited appointments, making sure they get notified very quickly via text messaging. And then for TANF clients who are receiving cash assistance and are at risk of losing their benefits because they're failing to comply with the terms, these quick text messages is a very inexpensive way to help bring them into compliance. So other human services examples, and I really like where we're going to with this, and I think Steve is one of the is on the front lines of this now, is really just full-scale program and vendor evaluation. If there's a vendor providing a service, that's great. You can contract with them, but how about letting them first demonstrate to you through a randomized control trial that they're outperforming the status quo? We have a trial underway now to look at programs provided for wraparound services for high-risk youth. We had a very nice trial also in Wyoming looking at changing the frequency and dose of cash assistance, so the same amount of money but spaced out differently. The challenge there was to try to resolve the front-end problem of many people have barriers to employment because they can't get the khaki pants that they need for the job, or they can't get to work because of no gas in the car. What we were able to do, and Steve can talk more to this in his section of this, but that we were able to very quickly, within a month or two, see that the problem that we were trying to solve created a whole host of separate problems, and now we're able to retool and go back in and test a different strategy. But the timeline was quick. Under a traditional research model, he would have known that 3 years from now. Under this model, he knew it within a few months. So how it works is individuals are able to contact us by phone or contacting us through the website. They submit an idea or they bring us in to work with the agency. This is more typical for us. We're usually flown in. We do a presentation to frontline staff and to the leadership. Folks then submit their ideas. Some agencies now have BetaGov email accounts that they send the ideas directly to that BetaGov dedicated email. We vet those ideas with leadership. We go through the compliance. We figure out what the compliance requirements are for that state. We then identify a practitioner point of contact for that trial. That becomes our pracademic, the person we work with on the implementation of that trial. Each trial is assigned a PhD. We have a cohort of them now. We have engineers, statisticians, economists, psychologists, psychiatrists. They get what they need depending on the nature of the trial. Every trial has a dedicated statistician, a case manager, and a professional writer. Many small things can become barriers to knowledge getting out there, and even something as simple as not being able to write up the one-pager because someone's too busy means that the next state isn't learning from that experiment. And off they go. They have everything in place. And our governing mantra is just big idea, small idea. We're dying to innovate with anybody who wants to try. And it's very rare for us to turn an opportunity to test away. There's been a few cases where ideas were submitted to us where we thought there were ethical issues involved and we didn't want to be involved with the work. But by and large, fantastic ideas are routinely submitted to us, and we're able to work with the agencies to get those tested on a very tight timeline. Any more information, you're welcome to look at our website. It's betagov.org. We are not funded on human services. We do that as an act of love. Everybody on the team there, this is all pro bono. No one charges for training. No one charges for consulting services. This is completely, really just public good, a public good philosophy, and we hope to hear from many others. Thank you. I'm going to hand over to Steve in Wyoming.
Well, good afternoon, good morning, whatever that is. Thank you, Angela. That's probably the third or fourth time that I've heard you go through the presentation, and or a similar presentation, and each time it's really exciting. As Dr. Hawken mentioned, by the way, I'm getting a lot of reverb in my phone. Is that coming through on the other end?
Yes.
Yes, Steve. Are you connected on phone and computer at the same time?
I am. Is that the problem?
Yes, I would change it to telephone on your computer and just speak through the telephone.
How is that now?
Perfect.
Is that better?
Yes.
Better? Thank you. That would have been a horrible experience for all of us. So, well, thanks for having me on. The work that Dr. Hawken is doing out here and her team out here in Wyoming, we're really excited about. In fact, I'm a little nervous. I think I heard you say that there are 75 folks on this call, and I'm a little nervous that that is going to mean that her and her team are more tapped for service, and we're kind of selfishly enjoying being able to throw ideas at them at a rapid rate. She talked about a little bit about one of the trials that we were working on with our welfare to work participants. We call that our POWER program, Personal Opportunities with Employment Responsibilities. When we provide monthly cash payments to those clients, and we're looking to increase participation in the program. We were also looking to increase people staying in the program and increasing the success rate, I guess, or the outcomes of the participants in the program, and thought that maybe if we offered weekly cash payments instead of monthly cash payments, that would provide additional incentive for them to either get into the program or stay in the program. What we found is that that's actually not the case, as she mentioned. The feedback we received was that at the end of the month, for clients who were receiving weekly cash payments, at the end of the month when they needed to pay their rent or their car insurance or whatever that was, that they didn't have the money because they had spent it as they received it throughout the month. So in my mind, as the director of the department, what I have talked about with our staff is that, well, it was a great idea, and we thought it would be helpful. But what we do know is that it's not. And it's equally important to know what doesn't work as well as it is to know what does work. So as Angela mentioned, now we can tweak what we were doing in that program and try something else. And through the process of these rapidly implemented randomized controlled trials, we'll get to what works, and then we can kind of formalize it and develop it as a standardized practice. Another thing that we're working on with BetaGov is, let me flip to that page, is taking a look at the time to receipt of services and the time to separation from the court system in families that are involved in the courts in one of our counties. In fact, it's Laramie County. 18% of our state population lives in that county. The families will be randomly assigned to receive high-fidelity wraparound services through a local insurance carrier, or to receive high-fidelity wraparound services directly through our department. That trial is currently in process. We're looking forward to seeing the results of that. Obviously, we're contracting with the insurance carrier, but if we discover that we're getting better outcomes, faster outcomes with our own staff, then we'll move that back in-house, and then we can redirect those contracted funds to other places where they're needed. I was also excited to hear in Angela's presentation, Angela, I'll talk offline with you about this. I had forgotten about the appointment reminder text. and we would love to engage with BetaGov in doing something like that in Wyoming. BetaGov will come to you. I think they've been out here a couple of times with us. The first time I think they sat down with, oh gosh, 35, 50 of our staff. As the director of the department, I was involved in that for maybe the first 20 or 30 minutes, something like that, and then decided I needed to get out of the room so our staff could speak freely, since they don't often feel that comfort when leadership is in the room. And at the end of that first meeting with Angela and her team, my understanding is they had about a dozen, 12, maybe 15 ideas that they wanted to engage BetaGov with, and I know that we're doing the 2 right now, but we have more that we're wanting to look at in the future. In fact, I was on the phone with one of our offices in central Wyoming yesterday around some efforts that they're doing with reunification of children and their families. They've developed specialized units in that office, putting teams of 5 or 6 around a child and a family to try to get them in the system, get them served, get them out, and reunified safely and appropriately. And I called them and said, you know, have you met Dr. Hawken yet? You really need to meet her and her colleagues. We need to be measuring this so that we can document what's working and not working. I love what, I didn't hear Dr. Hawken say this today, but one of the things I love about BetaGov is that she talks about these rapidly implemented randomized controlled trials being a process of creating knowledge. And in my world, I think knowledge is power. I think the more knowledge we have, the more we know what works, the better we can direct those resources to get the job done and meet our mission requirements. Any questions for me or our folks on this side?
Thanks, Steve. People should write questions they have, and we're gonna moderate questions at the end. So I really appreciate everything you've shared, and Angela as well. And I think in the interest of time, we're gonna move to Elizabeth. Thank you.
Hi everyone. I'm just in the process of trying to pull up my slides, so give me 1 second. And hopefully everyone can see them now. So it's so great to be on this panel because it looks like we all are kind of tackling this question from a slightly different angle, but we all have exactly the same mission. And the great news is that more and more players are actually doing this on the ground. So we'll have lots of examples of how this has been done, hopefully to inspire more projects in this space. So as Mike already mentioned, my name is Elizabeth Linos, and I'm the VP and Head of Research at BIT North America. Let me tell you a little bit about who we are before we get into the details. So BIT started as a governmental institution. So we started in the Prime Minister's office in the UK in 2010 as really the first governmental institution dedicated to applying behavioral science to how programs function. So this was really bringing together what we knew from psychology and from economics and trying to improve how we design programs. Crucially, alongside those changes to the actual programs themselves, we decided to rigorously test anything that we were trying, not only to build the knowledge base, but to really make sure that we know what works. So the team was very small when we started. As you can see in the image, we've now spun out of government, and we're now a social purpose company that has offices in London and Sydney and New York, and most recently Singapore. We're a little larger, but the mission is the same. So we work mainly with governments, but also with others that are concerned with social impact. And we try to think about how we can create realistic models of how people actually behave, use them to present tweaks to programs, and then rigorously evaluate using randomized control trial what works so that we can learn from that process in an iterative way. So I thought I'd give you a quick sense of how we usually run projects before going through some examples. Oftentimes when we start working with our partners, the questions that we are asked to tackle are really quite large. So, can you help us reduce unemployment or improve engagement or improve diversity in the police or stop antimicrobial resistance or, all these different types of very large social challenges. And what we try to do is think about how we can break down those large challenges into the individual pain points in a process or the individual micro behaviors where we think something's gone wrong or we haven't really hit our targets, and we can make some tweak or adjustment at that level, test it rigorously, see if it works, and over time build kind of social impact that way. So if you think about unemployment, for example, there are various small micro behaviors that affect whether or not someone gets a job, starting with do they show up to an interview? Do they turn in their CV? Are we encouraging small businesses to offer internships? Each one of those pain points in the broader process is an opportunity to tweak a process using behavioral science, test it rigorously, and learn quite quickly what works so that over time you're building a knowledge base about what's feasible and what's meaningful without having to wait 5 years or 7 years, as Angela mentioned, to get an overall program evaluation of a system change. So step one is we go through this process of trying to figure out what is the actual behavior that you want to change, and then we come up with an idea. Because we come from government, we try to make sure that we're incorporating practical and political constraints into the design of the idea, and of course behavioral science and field work. As Angela already mentioned, oftentimes the best ideas are coming straight out of the field work. There's someone who's a frontline worker or an innovator within a government partner who has already come up with a great solution. They just call it a workaround. They might not have even told their boss. They might tell us, oh, actually, like, this is what I do, but don't tell my boss because I'm just working around the bureaucracy. And really all it takes is someone to come in and say, another name for a workaround is an innovation. You might be right. This might actually be a better way of doing a process. Let's test it and find out. And of course, given what this workshop is about, we then test the idea using a randomized control trial. So, at its very core, we're basically splitting up the target group into at least 2 groups. One group gets business as usual, one group gets the new idea, and then we just measure what's most effective. An important note is that oftentimes we try to make these processes as low cost as possible, so the actual evaluation as low cost as possible. And we've found that with the administrative data that already exists and already is being collected, as well as with kind of the improvement, the constant improvement of technology, it actually is easy to answer a lot of behavioral questions about how people actually engage with government services without adding the extra cost or resources of data collection. So in many ways, I think one of the main fears that people have had over the past 10 years when it comes to research and especially randomized control trials seems to be less important in a world where we can use both administrative data and technology to collect data more quickly and more easily. So, there's a lot of things that you could potentially think about when you think about improving services with a human-centered approach or a behavioral lens. The framework that we use, and I encourage you if you're interested to look at our website for it, is called the EAST framework. And it's pretty basic. It says if you want someone to do something differently, make it easy for them, make it attractive, make it social, and make it timely. So I thought I'd walk through a couple of examples going through this framework just to give you a sense of the types of projects that we do and hopefully spur some conversation about what's feasible in other settings as well. So the first, and I think the kind of the most central tenet of behavioral science is, if you want someone to do something, make it easy. This is a project that we did in New Orleans where we were working with the Department of Health and a network of NGOs interested in public health called 504 HealthNet. And they were trying to get people who already had access to free health checkups to use the service. So as in many cases, sometimes through state funding or other funding sources, there is a population who is eligible for a service, but they're just not accessing it. So we tried the most difficult of cases. We worked with a population that hadn't been to the doctor in 2 years. They were all low income, and through a Medicaid voucher program, they had access to a health checkup. And what we wanted to do was test what message actually motivates people to go to the doctor. And we designed these messages alongside the health department. The first message was just kind of a very simple text message that clarified that this was available. So, hi, it's Chris from the health department. Text yes to be contacted to set up a free doctor's appointment. Text stop to unsubscribe. And then we thought, what can we add to this based on what we know from human psychology to try to just get more people to access this free appointment. So we added in another group a sentence that said, you have been selected for a free doctor's appointment, which really plays on people's ego, and we know that's highly motivating. And the last message played on people's need to take care of others, or what is often called pro-social motivation. So we added in the sentence that said, take care of yourself so you can care for the ones you love. Now, this is an interesting case because in a lot of the health departments where we've worked, or with a lot of health professionals or public health professionals, the norm or the expectation is that this pro-social message is going to be incredibly motivating and incredibly effective. But because we run this as a randomized control trial, we can actually see whether or not that belief is in fact true. So as you can imagine, people were surprised. I wouldn't be sharing this trial if things came out as expected. But we got a pretty good response rate for kind of a mass mailing for this type of population with just sending them a simple text message that gave them the information. The ego message was 40% more effective. So just playing on people's ego gets many more to sign up for this free appointment. And the pro-social message actually backfires. So it does worse than a simple message. Now, there's a couple of things that are interesting here. One is we can very, very quickly learn what works or what messaging is most effective, and sometimes we learn that what we thought was effective isn't. But because we had set up the system for iterative testing, we could then do a second round of text messages, run the most successful message again, the ego message, and try a new message so that you're constantly learning from the process and developing an understanding of what works for this specific population with very little additional cost. It turns out that the ego message keeps winning, so I'm not going to share all the versions with you, but it seems like we're additively getting more and more people to participate in kind of a huge program just by giving them a text message that is motivating. The second area is called attractive in this framework, and it basically means, we really need to think seriously about what we make more salient to people, so what actually attracts their attention, and how we think about making the services that we offer more attractive to people. This is a project that we did in a city that was focused on something very different. It was focused on collecting delinquent sewer payments in Lexington. And I bring this up just because there are so many opportunities where a city is sending out communication asking their residents to do something, and for some people it works and for some people it doesn't. So really maximizing that communication and the messaging in that communication allows for an impact with zero additional cost. If the city is already sending a letter, thinking about what should be included in that language can have huge effects. So in Lexington, we worked with the group of people who hadn't paid their sewer bills. And what we did is we said, how can we use what we know from behavioral science to improve the letter itself? Can we simplify it? Can we make a clear call to action? And can we make it as personalized as possible? So this is kind of what it looked like. I don't know if you guys can see it on your screen. We added in the name of the person. We told them that they owe a specific amount of money straight up at the top of the letter. We wrote, to pay now, visit this specific URL that takes them specifically to the place that they need to go to pay. And then on the outside of the envelope, we added in a handwritten note that said, hey, you really need to open this. Now, if you compare this to the usual letters that go out, you can see why they're quite different. And here are the results. So the control group receives the standard letter that goes out from the city to anyone who is a delinquent payer. As soon as we mailed the new letter that was just more personalized, more simple, we see this huge jump in the number of people who pay their bills. And that continues over time and has these additive effects as you think about all the different types of delinquent payers and type of different bills that you know, a government is associated with. The good news is that we've tried these types of revenue collection letters in lots of different contexts. Some of our most famous ones were in the UK with the tax department, and they were very effective. We brought forward around $300 million in additional revenue for the tax department. But in varied contexts, we see that the same types of principles apply, and the more we test it, the more we learn about what works. The third area that I wanted to focus on is making things more social, and here the basic principle is we're all a version of our middle school selves. We really care about what other people think of us. And if we can incorporate that into how we message services to people, we can actually have huge impacts on their behavior. So this is a project that we actually did in the UK to reduce antibiotic prescription. So this is a huge problem, a public health problem across the world, but antimicrobial resistance is something that national health departments or local health departments are thinking about all the time. What we wanted to do was think about the most cost-effective way of creating a reduction in antibiotic prescriptions. To give you a little bit of context, the UK's National Health Service had already committed hundreds of millions of dollars to a large marketing campaign just to have a reduction of 1% in antibiotic prescriptions. But we thought, why don't we just target a message directly to the people whose behavior we need to change, the physicians in this case, and tell them something about their peers and how their peers are behaving. So what we did is we sent letters to those practitioners that were in the top percentages of overprescribers, and we just let them know that other doctors prescribe fewer antibiotics per head than yours. So we did the analysis on the back end, figured out, given the patient population that they serve, what the norm was. We just let people know with a very simple feedback message that they were in the minority of people that were overprescribing. And here are the effects. So in the control group, you already see some variation in antibiotic prescription. The standard control group letter is a letter from, that goes out as part of a broader package of information for GPs or general practitioners. Adding in this letter that told them that they were different than their peers has a statistically significant large reduction in prescription. We stopped the trial in March, and we wanted to then scale up to everyone, and as we expected, those two lines come together. So we are seeing a large effect. Just by changing this letter, we got 80% of the way there for the UK government with a fraction of the cost, a significant fraction of the cost. And that's kind of where behavioral science, I think, is most attractive, figuring out low-cost ways to test what message is most motivating and use that to kind of save resources for governments. The last area that I want to talk to you a little bit about is making things timely. Now, this is a problem across a host of different government services. Oftentimes, we target interventions based on budget cycles or, what's appropriate from the organization's perspective. But we know that really when you target information at people can make a huge difference in how they respond. So this is a project that we did with job centers in the UK. So a job center is where you go if you are you're a job seeker, and it's where you get your benefits, but also where you go to get advice on finding a job. And because this is kind of a central location in cities or regions, large recruiters also go to the job center to post jobs. So if you think about a supermarket opening or an amusement park, they run these large recruitment events where they're hiring multiple people at the same time through a job center. Now, job centers in the UK have worked with us quite a bit, so they already were sending text messages to eligible job seekers that were pretty clear and direct. The basic message that you got was something that said, 8 new picker-packer jobs are available, come to Bedford on this date, ask for Sarah to find out more. Now, what we wanted to do, again, in a zero-cost way was vary the message that you saw in that text message to see, can we actually improve those rates of response? The first thing we did is just added the name of the person who was receiving the text message, because we know personalization is particularly effective. Then we said, can we also add in the name of the job coach? This is the person that they've been working with to try and find a job over time, so it's someone they know and they have a personal relationship with. And the last thing we did was add a sentence that said, I've booked you a place, good luck. And this draws on a lot of psychological research on reciprocity that argues quite simply, if I do something nice for you, not only do you repay me, but you repay me in spades. And these are the results. So in the control group that was receiving a text message anyway, only about 10% of people were showing up to these recruitment events. And that's a shame, because these are relatively easy ways to get a job quickly compared to other processes. Just adding in the name of the person increases the response rate, so the number of people who show up, by 50%. Adding in the sender's name improves it even more. But adding in the simple sentence that says, I booked you a place, good luck, more than doubles the number of people who show up to these interviews. And that, again, gives you an example of small tweaks that can actually have a large effect. The important thing, I think, for this panel is that without the randomized control trial, no one would have believed that this difference was this large, and so they wouldn't have paid attention in the next round when they were thinking about what message to send to people. The randomized control trial, in effect, it works as proof of concept that we should be thinking seriously about the messages that we're sending out. And before I stop, I wanted to give you one more example, just because a lot of the examples that I've given are small nudges or things that are kind of one-off, low-cost trials. Sometimes you can't solve a problem with a nudge, and a randomized control trial is still a great idea. So we've worked, as I mentioned, a lot with job centers in the UK, and at some point they asked us to think about the experience as a whole of entering a job center. So we did quite a bit of field work where we sent people to try and get a job or try to get services, really following the experience from the user's perspective, but also from the frontline worker's perspective. And we found that actually, the moment you walk into a job center, the first 30 minutes of your time is spent signing forms. And there's 9 forms to sign. So we said, can we refocus this process only to the forms that are legally necessary? Can we simplify the language so that you only have to sign as few times as possible? It turns out that number is 3. And, the language actually makes sense. We then added in this commitment booklet, which basically asks people to write down in their own handwriting what they're going to do in the next few weeks to help them find a job. Again, this is part of of a legal context, which is very similar to places in the US. In the UK, in order to find a job, or to continue to be on job benefits, you need to prove that you've searched for at least 3 jobs in the past 2 weeks. Within that legal context, though, we knew that asking someone, hey, what have you done in the past 2 weeks? Have you searched for 3 jobs? Really anchors people to the wrong number. It sends the message that all you need to do is search for 3 jobs every 2 weeks, and miraculously you're going to find a job. So what we did is we said, rather than asking people, what have you done in the past 2 weeks to find a job, we asked people to write down what they're going to do in the next 2 weeks to find a job, and we didn't use the number 3. We just let them write down whatever they wanted. And you see this huge increase in the number of people who commit to much larger goals, like identify 200 employers, or send my CV to 50 different people. And we expect that most people don't do that. Most people will send it to 10 and not to 200. But that's still a lot more than 3. And the last part of the process that we changed was we focused quite a bit on the strengths of the job seeker. So anyone who's been unemployed knows what that feels like from morale perspective. So we wanted to find a way to help people reorient themselves towards what they're good at right before they go into a job-seeking environment or an interview. So here we weren't just making a small tweak, but we were thinking of this as a redesign of the process or the experience of trying to find a job, and structured it as a randomized control trial, first as a small pilot, and then as a regional randomized control trial, and now it's national policy because of the results. So in the control group, in what is admittedly was a very difficult financial environment during the financial crisis, about 51% of people actually found work in 13 weeks. In the treatment group, so in this redesign process, we increased that significantly by 5 percentage points. And that translates initially into 2,000 people in the first round, more people in the regional, and now because it's national policy, millions of people are affected because we were able to prove that evidence base iteratively and rigorously. So I'll stop there, and I look forward to our conversation later, but you have my email and you have our website on the screen, so if you have any other questions that you want to discuss, feel free to get in touch.
Thank you, Elizabeth. And I'll turn to Jon.
Good. So I'm going to show my screen here. Good. Is my screen showing?
Yes.
Okay, good. So I'm going to talk first about just a brief introduction about why I suggest what we've been talking about here, what the previous speakers have talked about, this process of building evidence is so important. And then I'm going to talk about some of the work that our foundation has done and is doing in terms of funding these types of studies and related types of low-cost randomized controlled trials. So why is the process of evidence building, rigorous evidence building randomized trials so important? I'm going to suggest it's not just a desirable thing for good government and running your program properly and all of that. It may be essential if we're going to make progress as a country against poverty and educational failure and child maltreatment and other problems. And here's why I say that. If the history of rigorous evaluations has taught us anything, it's that many widely held beliefs about what works in medicine, in social spending, and in other fields are not accurate. So in business, a fellow named Jim Manzi wrote a book a couple of years ago that got a lot of attention called Uncontrolled, reporting that Google and Microsoft have conducted 13,000 randomized controlled trials of new business strategies over the past few years, 80 to 90% of which were found to produce no significant effect. In Manzi's words, innovative ideas rarely work. Similarly, reviews that have been done in medicine in different fields have found that between 50 and 80% of promising results in initial studies, initial clinical studies in medicine, are not confirmed. They're overturned when a larger, more definitive randomized controlled trial is done in what is called phase 3, the kind of large randomized trial that's needed to get approval from FDA for a pharmaceutical drug to be licensed. So even in that case where you have some promising initial evidence, in most cases the strategy, the intervention is still found not to work when definitively evaluated. The same thing holds in social spending. In education, the Department of Education started funding large randomized field experiments in 2002. Close to 90% of those were found that interventions being evaluated, many different types, teacher training programs, curricula, and so on. Close to 90% were found to do no better than what schools were doing anyway in the control group. Same thing is true, similar pattern for the hard-to-employ demonstrations that HHS has done, employment retention and advancement, interventions, workforce and other interventions for people on disability insurance to try to improve their workforce and health and other outcomes. And the Department of Labor, long story short, maybe between 75 and 90% of those interventions tested are found not to produce the hoped-for effects. So an absolutely clear lesson is, I'd suggest, the need for humility in our beliefs about what works and the fundamental importance of rigorous testing if our efforts in social spending and medicine and other fields are going to improve the human condition. In fact, I guess it's kind of hard to see if you don't have a mechanism, because most things don't produce their hoped-for impacts, most strategies. If you don't have a method for identifying in a valid way the subset that do produce meaningful impacts and then scaling them up, it's hard to see how social spending is going to make progress in solving our country's major problems. So that's sort of a plug for evidence-based approaches and rigorous evaluations generally. Randomized controlled trials, just to give this has sort of been assumed, I think, that most people know what that is, but just to make sure everyone's on board here, a randomized trial is generally considered, where it's feasible, the most scientifically credible method of determining whether a program works in many different fields, according to standards from the Institute of Education Sciences and the Food and Drug Administration and the Congressional Budget Office and the National Science Foundation and others. A randomized trial is, very simply, it's a study that measures a program's effect, such as a job training program's impact, by randomly assigning a sample of individuals to either a program group that gets the job training, in this example, or to a control group that does not. They get usual services in the community. Then the study measures outcomes for that program group, that treatment group, compared to the control group over time, like outcomes like employment and earnings, to see whether the program group has superior outcomes. What's so special and unique about a randomized trial, why it is considered the strongest method when it's well done, is that process of randomly assigning a large number of individuals to either the treatment or control group ensures to a high degree of confidence that there are no systematic differences between the two groups in any factor except for one. The program group gets the program, the control group does not. So any difference in outcomes over time can confidently be attributed to the program and not to other factors. That's sort of the definition and the reason why random assignment is considered especially strong. By contrast, non-randomized studies like comparison group studies, where people in a treatment group who volunteer for a program are compared to people in a control group who did not volunteer, that kind of comparison group study cannot rule out the possibility that the program group, because they volunteered, has a higher level of motivation than the control group that did not volunteer. So even though the two groups may look the same on observable characteristics like income and education and so on, that kind of study can't rule out the possibility that the program group's higher motivation accounts for their superior outcomes, their superior earnings and so on, compared to the control group, rather than the program. Anyway, that's the importance of random assignment and why it's unique. It's not the only method. There are some good alternatives when random assignment is not feasible, but it is generally considered the strongest method. So I'm going to talk. We are supporting Angela's work and consider it to be very important. There's also another strain, another type of low-cost randomized controlled trial that we fund. We have a number of funding announcements a couple funding announcements that I'll describe in a moment to fund these types of studies, and we hope you'll find them to be of interest. They're a little bit different than the quick turnaround studies that have just been discussed. These studies are designed to measure the longer-term outcomes, the ultimate outcomes of policy importance, like for a workforce training program, what is the longer-term, both the short-term and the long-term effect on employment and earnings? Or what's the effect on child maltreatment rates? What's the effect on child safety? So these studies are designed to measure the ultimate outcome that's of self-evident policy importance. the reason why, and to do it over a period of time. The reason why we believe that's important as sort of a final stage of the evidence building process is that frequently effects dissipate over time. There are many programs, for instance, transitional jobs for ex-offenders, where they've been rigorously evaluated and been found to have a large short-term effect on employment and earnings. But then as soon as the subsidy goes away, the effect diminishes almost immediately. So there are many programs like that in different areas, what's called the fade-out effect. And so if you're going to determine whether a program produces an enduring improvement in people's lives, in many cases, longer-term follow-up is important. Also, in a number of cases, sort of the short-term measures or the immediate measures of program take-up and so on, they can be important. They're sort of an antecedent. You need to have people participating in the program in a full way, but sometimes you may have increased take-up of a program that ultimately is not an effective program. So even if people are participating at 100%, et cetera, they're completing the program, it still does not produce the hoped-for effect. And there's some examples of that as well. So as the end stage of the evidence-building process, we believe it's important to measure those longer-term impacts and over a sustained and the ultimate impacts of improvement in people's lives. My main point here is that it is possible to do that in a number of cases at low cost. So let me just give you a couple examples. I'm forgetting to turn the slides here, but let me give you 3 concrete examples which I think will illustrate the conditions where these low-cost, longer-term randomized controlled trials are feasible and will produce results that are of policy importance. So the first one on here was a study that was done in the child welfare system in the late 1990s by a fellow at the University of North Carolina now, Mark Testa. It was done under a waiver given by HHS to the state of Illinois in the child welfare program to implement a program called subsidized guardianship, which is an alternative to foster care in which the state pays a subsidy to a child's relative or like their grandparent or aunt or whomever to become the child's legal guardian. The approach, subsidized guardianship, is similar to adoption, but unlike adoption, it doesn't require the termination of parental rights, so it can be easier to achieve from a legal standpoint. Illinois, as a condition of getting the waiver from HHS, did a large randomized controlled trial. 2,400 foster care cases were randomly assigned to have this option of subsidized guardianship or to the control group, which got foster care as usual. That's the first piece needed to do a low-cost trial. You can embed random assignment, a lottery process essentially, into an ongoing process. These were children that were already part of the foster care system. Some of them were going to be randomly assigned to get the intervention and some were not. So you didn't have to go out and recruit a sample for the study, which can drive up study costs. So first condition was true in this case. You can embed random assignment into as part of usual program operations. The second condition to do a low-cost trial is that you can measure administrative data over the short and long term using administrative data that are already collected for other purposes to measure the key outcomes. So in this case, for all 2,400 children in the sample, their foster care outcomes, such as placement in a permanent home and rates of child maltreatment using CPS data, were all measured with administrative data that the state of Illinois already collected for other purposes. So you didn't have to go out and do what is usually the biggest cost in a randomized trial, which is to track 2,400 people and administer tests or interviews and all of that. No original data collection. This is all administrative data. This whole study was done over a 9-year period. It cost just $100,000. It produced a very important finding. It found an increase in children's placement, permanent placement, by 8% over that period. It reduced the average days in foster care by 16%. It produced net government savings of $2,300 per child because subsidizing a guardian is cheaper than foster care, and it did not have an adverse effect on CPS reports of child maltreatment. This finding was replicated in other trials in other states and ultimately led to a change in federal law to allow subsidized guardianship nationally, which the Congressional Budget Office estimated would save $800 million over 10 years, and they used the evidence to make that. So this resulted in an important change. One important aspect of this, it measured the short-term impacts. You had an impact a year, 2 years later, 3 years later. You could all measure that with the administrative data, but you also measured the ultimate impact on child health and safety and placements over a 9-year period. So you had the longer-term impact as well. Let me give you one other example, and then this was a reemployment and eligibility assessment program that the Department of Labor launched. This was a randomized trial, basically, of a reemployment program. I won't give you the details of how it worked for unemployment insurance claimants. It was a 4-state randomized controlled trial. They had, believe it or not, a sample of 135,000 UI claimants measured over, and their employment and earnings were measured using administrative data over a 20-month period, over an 18-month period. The whole study cost $320,000 to do, which is amazing. I mean, it's a fraction of the usual multi-million-dollar cost for a study of that size, because random assignment was built into the UI unemployment insurance intake process. The claimants were randomly assigned to this reemployment program or to UI as usual. And all outcomes, employment, earnings, receipt of unemployment insurance, those key outcomes were measured with administrative data that the states collected already for other purposes. The study found that one of the 4 states, which had a slightly different program than the rest, Nevada, produced sizable impacts, about a $2,800 increase in earnings per claimant over a 2-year period, net savings to the UI system of $700 per claimant, and the Department of Labor has subsequently, U.S. Department of Labor has subsequently scaled up that Nevada approach to other states. So again, that had an important policy impact. All right, so it was inexpensive. So we fund these studies. We look to fund a lot of these studies. Our board has said that we will fund all proposals for low-cost randomized controlled trials costing between $100,000 and $300,000 that receive a strong rating from our proposal review panel. Here are the criteria that would need to be met. One is the importance of the intervention, and that's defined sort of in a specific way. We're looking in particular for highly promising prior evidence to suggest an important effect is possible. It can't be just a case where you can do random assignment. Wouldn't it be nice? Wouldn't it be nice to build the evidence? Because so many strategies do not work, ultimately are not found to produce the hoped-for effects. We look to evaluate programs where there's some promising evidence to suggest a meaningful effect is possible. So some compelling reason to think the thing might work. That's number one, and that's, to be honest, that's the hardest one to meet. So second, we look for on the proposal team an experienced researcher who has done a well-conducted trial before. We ask them to send us a copy of their prior trials. Third, we look for a valid study design. We're looking for big trials, thousands of people if possible, hundreds or thousands in the sample of kinds I just described. Measuring outcomes that are of self-evident policy importance, not just initial outcomes about program take-up and operations and all of that, but the ultimate outcomes that like employment and earnings and child safety that the program is designed to achieve. And then you have to have the partners that have agreed to participate in the study. We get a lot of proposals. Our latest round, we got 89 letters of interest. It's an easy process, 3-page letter of interest to send to start the process. We're probably going to fund about 10. Those are all the ones that sort of met these criteria on the head. We don't get enough good proposals, so it's not a lack of funding here. We'll fund everything that sort of meets these criteria in a solid way. So if you have a good proposal, that meets these criteria, there's a very high chance that you will get funded. So we'd encourage you to participate. We also have, I'm just going to mention, a second funding initiative for randomized trials that are not necessarily low cost. They can be, but are not necessarily. This is basically cases where we would fund the randomized trial of a program whose delivery is being funded by government or other entities. And the selection criteria is similar to the low-cost RCT competition, but meaning you have to have promising evidence or something that promising evidence or something that's very widely implemented. But the studies need not be low cost. Sometimes you can't use administrative data to measure important outcomes, so we will consider those as well. And here's the information to obtain copies of these requests for proposals. We try to make it easy on folks. 3-page letter of interest. We'll look at that. We'll review it. If it's rated highly, we'll ask for a full proposal, 6 pages, and then we'll get you an answer. So it'll go to our review panel, and we'll get you an answer. So we hope you'll consider us as a potential funding source. We're excited about these low-cost trials, and would love to have you participate.
All right. Thank you, John. It's a fabulous panel. Thank you all very much. I know we only have about 12 minutes left, and I know we have a number of questions to get to. I'm going to take the moderator's prerogative, though, after listening to Elizabeth's presentation. I just have to mention that MEF Associates, as well as together with MDRC, have been involved in the BIAS project for the last 5 years, testing behavioral in 7 states and 15 tests over that period of time in the human services arena. And we are currently launching BIAS Next Generation. We'll be doing tests in TANF and in the child welfare arena initially. So anyone out there who is interested in doing something related to behavioral interventions in TANF or child welfare, reach out. We will be providing the evaluation at no cost, and we're excited to find good and interesting sites for those tests. So now that I've made my plug, I want to, I guess we got several questions. There's no way I can get to all of them, but there's one question that's come up that I'll kind of combine a little bit around both for sort of apply to both Elizabeth and Angela in terms of the kind of the time frames for your engagements with these evaluations. How long do they take? And how much do they cost? When you say they're low cost, what do they cost, and what tends to make evaluations more costly than not? I'll kind of try to combine a few things together. Elizabeth, you want to go first?
Sure. And I know it's a very unsatisfying answer, but it really does depend. The timeline. Usually the constraint is usually what the outcome is that you care about, right? So as John mentioned, where you kind of pull the plug and decide you don't want more evidence really determines the overall timeline. But the good news is you can start getting results quite quickly. So for some of the projects that we've done where, really what we're interested in is, getting a more diverse police force, for example, where the thing that you care about is measured once and measured relatively quickly. You can have a trial up and running and get some initial results within 3 months. In other cases, it's even faster than that if you're trying to measure those initial proxy outcomes, like are people responding to a health text message. Between maybe the design takes a month or two, including approvals and legal and all the the things that everybody on this call is familiar with, but you get those initial results quite quickly. You can get results within a week. The question then is, and you should always follow up and see the longer term outcome. So that just depends on the program. Sometimes program data is collected once a year, and so you have to wait a year to see what happened to those people over time. Sometimes you get results monthly, and that's exciting too. In terms of cost, I think John really brought forward some of the main things we think about when we think about reducing costs. The main one is data already available? And can you create a system of randomization that doesn't require a person, doesn't require individual involvement on a daily basis, and that is actually often possible. I guess the last thing that I would think about when you think about reducing costs is how monitoring happens. So in these usual traditional large-scale trials, you spend quite a bit of time and resources monitoring that the treatment group is actually getting the treatment and the control group is actually getting the control, and that there's not a lot of people going in between categories. But oftentimes there are ways to be creative about that and think about ways to monitor that involve technology. So if you're trying to get people to access an online service, you can see through the website or through the data that the website's already collecting how people are interacting with that website and how often. So that really reduces the cost. I don't know if that answers the question completely because it really depends, but I guess the headline is it doesn't cost $1 million and it doesn't cost 3 years of your time, which is, I think, how everyone thought about randomized control trials maybe 5 or 10 years ago.
All right, thank you. Angela, you want to comment on that question?
I think my response will really mirror what you just heard from Elizabeth. It really depends on what you're studying. And we have such a terrible business model here because we charge nothing, right? So we have to be very careful about making sure that what we're doing is low cost. And as Elizabeth said, it often boils down to, is there a randomization scheme that can give you high fidelity to your condition assignment, that you can make sure you have checks in place to make sure that folks really got what they said they were giving them, but that's cheap to do. Our trials, for example, those chairs I showed you in the maximum security prison situation, that's one example of one of our more expensive studies because that actually involves stuff. And even there, that trial, those chairs cost about $1,800 a piece, $1,800 a piece. That for us is, in our world, an almost more expensive trial because it involves some stuff. It's like $20,000 just to get it into those facilities. But we can have multiple cohorts going through it. We've had trials where the entire trial cost $4. We have other trials where it's it's definitely just coming in at under $100,000. But what we try to do is think of a model of economies of scale. So often in a traditional research team, you have a principal investigator, a statistician, maybe a communications analyst, writer, and they divide it over, if you have a good productive shop, maybe 5 or 6 or 7 studies. If you have lots of studies, so our philosophy now is when we meet with a state agency, our only requirement is we will do everything for free as long as you promise us 12 trials. Because for us, it's cheaper by the dozen. Because we can distribute staff over many different studies. And initially, there was like, what, seriously, you're only flying out if you do a dozen? And that was met with some resistance. Now they're just like, it's great. Now we have, for example, in Pennsylvania, this one of the state agencies that brought us in, they said, okay, we'll come in. And I said, cheaper by the dozen. He said, I'll give you 100. So for our business model, dividing over 100 trials, that makes the per trial cost actually much less expensive. As long as Jon said, the administrative data is available. My team cannot collect original data. We don't have the field staff for that. The data has to exist already. There has to be a mechanism to randomize. It's cheap and easy to do, and practitioners who are willing to play. But what's nice when you're testing their ideas rather than yours is they want to play. They want to try this. It's their staff have raised their hand. It overcomes all that having to sell them something problem, right? Because they're doing something that they wanted to do. So I'll say from now, our trials have honestly ranged from about $4 a trial to probably just under 100,000. And quickest trial we completed from first call with the agency to first results was 6 weeks. From 6 weeks, and that was before the agency had ever heard of BetaGov. So I mean, it was the whole process from beginning to end.
Thank you. And I think it's really, a lot of us have been saying for a long time that it doesn't take forever and cost a lot of money to do these trials. I guess one of the questions that I have is, as you're working with folks in state and local government, how do you convey the benefits of going through a randomized trial as opposed to just simply tracking outcomes? I mean, everybody's busy tracking outcomes to benchmark performance and gauge progress. What's been your experience in working with leaders at the state and local level to get them to see the benefits of engaging in a trial? Either one.
I can start. So I've been really impressed with just the excitement and interest and understanding of why this matters. So in a lot of cities, most of my work is in cities right now, there is a data analytics person or team, there's an innovation person, there's someone who's running stat meetings. Those are usually the kinds of people that already are convinced that data matters, and they just want to take it to the next step. So if we think of performance measurement as step one, and thinking about data in that way, the next stage is, okay, how can we use this to actually inform how we make decisions and measure the impact? So I think there's already quite a bit of thirst for it. The challenge sometimes is convincing people that this is not going to be just another thing on their plate that they need to do, and it's not going to be too difficult or too time-consuming on their staff. So I think, you know, and we come from government. I used to work in government, so I'm super sensitive to this. The only way that I've found to make this effective is to start with a project where that's definitely not the case, where things are relatively low cost. So, you know, anytime a team is already, for example, sending out communication, it already has resources to deliver a service, and we can say, look, let's just make that process slightly easier for you. That's always a good place to start. But I've been pleasantly surprised. So, you know, I've been working kind of in this field for a decade now. A decade ago, the questions that were coming up about, you know, this is too difficult, this isn't necessary, you know, we already have good evidence from, you know, from the focus groups that we're running. I'm not hearing that as much anymore. The main question is, how can we actually do it, and how can we do it quickly and cheaply? And I think we have a solution to that, but it's a very different type of challenge than the initial one.
Okay.
Yeah, my experience is very similar to that. The one thing we do though is always make sure that the head of the agency, or if it's a county, the head of the department, is like the leader is sending a very strong message that it's okay to innovate, and that person supports the process. So you're rewarded for the process rather than an outcome. So you can reduce the anxiety around the trial, right? It doesn't matter if it works or not. The point is you're trying, and you're really, you know, working towards innovation. The other thing I think we do a lot of is just explain, once they hear this, the light switches go on, just explaining what the private sector does in this regard. There's so, if you look at the big box stores, there's so much experimentation happening around already trivial, you know, trivial operational details. And I explained to them, your jobs are so much more important than anything Walmart's doing. If Walmart's doing this routinely, why are you not? And that, you know, the outcomes in your world, you know, you're looking after children and you're looking after inmates. That message of, you know, the private sector's made this easy, why can't we, is one that tends to go over quite well.
Thank you. I feel like I need to respect timing, and we have lots of questions here. We'll try to see if we can find some way to share questions with the presenters, and if we can get responses, we'll post them on our NAWRS website. We're also going to post the presentations on the NAWRS website, and as well as a recording of the webinar. So I really appreciate everyone's attention. I want to give my own applause to the presenters for a job really, really well done. We had time to keep talking, but I want to respect the time frame. So I wish everybody a great rest of their day, and happy trialing to you all.
Thanks, everyone.
Hey, thank you, everyone. This is Steve from Wyoming. I want to, if John's still on the phone with the foundation funding BetaGov, we from Wyoming truly want to thank you for that funding, and those efforts. We're benefiting from that, and truly appreciate it.
Thank you. That's great to hear, and really appreciate your saying it.
Right, and I just really thank all the presenters, John and Steve and Angela and Elizabeth. Great job. Thank you.
Thanks, everyone.
Yes, great job. Thanks so much.
And a shout out to Apt Associates for sponsoring the webinar today.
Yes.
Thank you.
Thank you.
Yes, thanks.